30 on the Official Languages Act is that the services offered to the public have to be given in one or the other official languages. Recently, the report by the Commissioner on Official Languages made comments about Ambulance New Brunswick. So my question is to the Minister of Health. Does he know about this report, and what has he done since the report was tabled?
Thank you, Mr. Speaker. The Official Languages Commissioner made several recommendations after receiving some comments concerning Ambulance New Brunswick patients. In some recent cases, we've looked into these. Ambulance New Brunswick knows that it's an important issue and recognizes that there's still work to be done. And Ambulance New Brunswick is working diligently to improve its services in both official languages. The government believes that New Brunswickers should have access to healthcare services in the language of their choice, which indeed includes ambulance services.
Mr. Speaker, the Commissioner, Mr. Carrier, alluded to two examples, among many others. There were situations when residents called Ambulance New Brunswick to come get them in a critical situation. And what is more disconcerting is that in one situation that was in the Dieppe region, where there is a huge Francophone population, so you would expect to have bilingual ambulance workers. And when we're in a critical situation and we cannot communicate with the workers, it is a problem. So that was the type of comment that was made by Mr. Carrier. Ambulance New Brunswick does not deny the facts and recognizes having failed its obligation. So they recognize that they were wrong. And the Commissioner said that after 5 years,
Minister of Health. I don't know what the question was. I'm not trying to be smart here. I mean, it was a long discussion of a number of things and a long preamble, but I simply state that bilingualism, the Official Languages Act, is a serious piece of legislation that the Alward government takes seriously. Anyone at one particular time can find some obscure anecdotal situation where maybe things fell through the cracks. That's got nothing to do with government policy. That's got nothing to do with our commitment to the official languages of this province. And as with any evolving and working forward in any situation, there's always room for improvement, and there's always a few things that happen. But that's got nothing to do with the commitment of this government to provide medical services in the language of their choice to all New Brunswickers.
Mr. Speaker, this is not an obscure situation. Those are very concrete situations. The Commissioner gave 4 recommendations. So have a deadline to meet the goals, have an accountability process, have a person in charge of this process, and have make staff aware of their linguistic responsibilities. Will you make sure that all those 4 recommendations are implemented?
It was a long list. I want to confirm the fact that the Official Languages Commissioner, in doing his job, makes recommendations on a go-forward basis. That's his job. That's what he's supposed to do. He has done that with respect to Ambulance New Brunswick. I think that those are things that we're going to look at seriously. Why wouldn't we? It's the proper and appropriate thing to do. We are committed, as I've said once, I'll say it again and again, to try to make something political out of this is really kind of silly. We are committed to the Official Languages Act. We're committed to providing New Brunswickers with health care in the language of their choice. And that includes Ambulance New Brunswick, includes the health authorities, includes anywhere else. And we stand by that commitment, and the Alward government has not varied from that since the day it came into office.
Thank you, Mr. Speaker. Speaker, yesterday, the Minister of Education